35 minutes. That's pretty good.
The topic that we're gonna cover is the natural ways to help with pain, muscle spasm, restricted mobility, and how to prevent permanent injuries for the rest.
Hey, Chris, can you see how you could have zoomed in more?
Yeah, I definitely see that now. Yep.
Yeah. And you're not wearing a microphone, are you?
No, I am not.
Okay. Remember, you want to, what's one of the main reasons you want to record this? Well, one is for a breakdown analysis, but the other one is you want to use it so you can use it on your website. You can use it in a funnel. You can use it for pay-per-click. You want to upload it to your YouTube. In other words, it's like an evergreen webinar. It's like a new patient presentation. It's always working for you. So you can use it over and over again. So it's an automated way just to, get patients periodically. But, when you got one that looks good and all that, you can easily use it for pay-per-click. You can use it. That's like when you go to your, one of the best places to use this when you get it recorded is on your website. Or do you have an opt-in where on the front of your website, Chris?
Not currently.
Okay. One of the best things you can do with this is if you have an opt-in on your website, because remember, most people that come to your website don't call you. You're aware of that, right?
Right.
So you want to capture them. You don't want them just to come to your website and leave. You want to capture them and then you want to follow up. This is one of the best things that you can do is capture them and then they get this presentation. That's why you want to record it. So I would get the positioning right. I'd, get the camera right, get the zoom in right, get everything right, where everything's positioned right. The lighting is pretty good. Got your white jacket on. Okay. But you're gonna need to wear a microphone. The sound is really bad. So you're gonna have to wear a microphone. Now they have those real easy Bluetooth that they're lapels, they just clip on. It's a Bluetooth microphone. Matter of fact, this is one right here. This is one right here. That's a Bluetooth. It's USB charged. Now this is not on. I'm not using this one. I actually have a microphone right here. You can't see. But you want to get something like this. I think it's only like 30 bucks or something. Really inexpensive. To definitely have a better sound. Okay, let's take a look.
Rest of your life. Okay, everybody knows who I am. I'm Dr. Howard Wright, chiropractor here in Wilson, Missouri. Just a little bit of background information about myself. I'm a member of the National Board of Chiropractic Examiners. I have obtained over 300 hours involving neuromusculoskeletal conditions, and I've treated over 10,000 patients, visits involving pain. So tonight, we're going to talk about what we want to move away from, and also what we want to move away to. Before we begin, we're just going to go around. Everybody's going to say their name. Okay, we'll start out with you, Grace. What's your name? Lamont. Jarrell.
I'm Greg.
Greg.
I'm Grace.
Grace.
Stephanie.
Stephanie. All right. So we're going to talk about problems. Okay. We're going to talk about what we want to move away from and what we want to move away to. We want to move away what? From problems. Okay. you guys feel the shootout on the other side? Do you know anybody that's dealing with problems involving like pain, arthritis? We'll have everybody stand up. We'll do it this way. Everybody stand up to be easier. Okay? You all on to your clipboards, because you're gonna be standing alone, okay? So have you stand up. All right, so anybody in your family that are dealing with pain, arthritis, any kind of old injury, you can sit down. Please sit down. You have anybody in your family? Okay. Yep, that are dealing with it, okay? All right, anybody that has friends that are dealing with any kind of pain, arthritis, or restricted mobility? Any friends? You can sit down. All right, that covers everybody, right? So you got friends and we got family, okay? What are some of the problems that you all put down for your family and for your friends? Does anybody put down neck pain?
Yeah, that was a good way to immediately involve them, is by activating like that, by having them stand up and say their name and involve themselves. That kind of forced them to participate right there.
You put down neck pain, okay? Who's dealing with neck pain? I put down what I was telling my grandmother. Your grandmother, okay? What's she dealing with? You said, what's she dealing with? Is she dealing with neck pain?
Yeah, neck pain, joint pain.
Joint pain, okay. Mama, who'd you put down? Did you put anybody down? Your dad's dealing with back pain? Okay.
Well, I put down my mom, cause she always talking about her joints, her knees.
Her joints and legs and the knees, okay.
I didn't say that anybody, but thought about mother-in-law too, so.
You concur, right? Okay, right. So we're talking about our family members, right? Well, why? Because we're involved in their lives, right? And again, like I said, the benefit, the goal here is not only just to help you guys as patients, but to be able to help your family members and to help your friends, okay? So I just want to share with you a little story, how, when I was already, this is me already practicing as a chiropractor. I was working downtown for a doctor. He owned 3 offices, and I helped build up his busiest office. And on my way home from downtown on Highway 70, I got hit by 2 cars on the highway. One smashed me over to the right, another one smashed him behind me. Well, I went to the hospital. They gave me medication. I went home. Well, after a few days, the pain I had, this seemed very mild, got worse. I had neck pain, I had back pain, it got so bad. I was an avid jogger. I could jog 4 miles in 30 minutes. I went from that to not being able to jog anymore. My children were real smart, couldn't pick them up, I couldn't work. I got chiropractic treatment, and through the series of chiropractic treatment, at the end, I was able to go back to jogging, playing with my children, going back to work. So I want to share with you some of those benefits that I received, and hopefully that will be, it will help you to a certain degree. Okay? You had your hand up.
Question, were you a chiropractor before you had the accident, or was this?
Good question. So I've had 2 accidents. The first one I had, I was 10 years old. The second one I had that I just mentioned, I was already practicing. So for me, it would have helped me out because I knew everything by the book, and I knew everything by how the patient reacted. I knew the therapies worked, right? But it was always sympathy, right? I couldn't empathize because I had, as a child, I hadn't really experienced any injuries. Well, this time I experienced those injuries. So I knew how it felt, how bad it was to lay on the table. I knew how it felt because it was affecting my daily activities. I knew, and it helped me to be, I think, to become a better doctor, because now I couldn't just sympathize, I could empathize.
Yeah, what's interesting there, Chris, is you're now talking from unconscious incompetence. You're talking from the heart. You're talking to them personally. This is coming across real well. Because you can tell you're not guessing, you're not thinking of what to say next. It's all, I mean, it looks like it's honest. It's coming across real well. It's very personable. And again, you're coming from a state of unconscious competence. You just know what you're doing.
Okay, good question, good question. All right, so what we're gonna do now is I'm gonna draw your attention up to the triangle of health.
Okay, so that was the start. That was a good start. We went from introduction, what the title is going to be about, engaging them, their and specifically their loved ones with a chief complaint. You did the authority statement, and you gave your personal story. So we're off to a good start.
You can see on your form there, there's three components to the triangle of health. Three major categories. There's a nutritional aspect, there's an emotional aspect, and there's also a physical aspect. Okay, this is basically the triangle of health. You could have problems in any one of these areas, or they can impact one another. Could anybody give me an example of what they think would be a nutritional problem? Anybody think of a nutritional problem?
Probably a lack of vitamins.
Lack of vitamins, okay, that could lead to what? Lack of vitamins?
Bone deficiency.
Bone deficiency, that's a good one. Okay, anybody else think of any other ones? What about diabetes? Diabetes is another one, right? What about emotional? Anybody think about emotional? I'm gonna pick on Lamont because he got his head down. Lamont, you think about an emotional problem?
That was good. That was good. Somebody who may not be paying attention, you call on them.
Think about anybody having like an emotional problem. Stress, yeah, helping Lamont out. What about, hey Lamont, what about depression? Would that be like an emotional problem? Yeah, so depression could be an emotional problem, okay? And one could lead to another. What could be a physical problem? Unable to walk, right? Arthritis or something like that, right? Or weight gain, that could be a physical problem. And one can lead to another. I could be down and depressed, right? Which will cause me to have a physical problem. That could cause me to have weight gain. I could have weight gain, and that could lead to having a nutritional problem like diabetes, right? I could have a problem with nutrition, right? Malnutrition, and that could lead to me having an emotional problem because now I have this nutritional problem. So you see how all of these can relate to one another, okay? Now, if you have a problem like diabetes, what kind of specialist is gonna help with that? Anybody know? Anybody know who would help with that? What kind of specialist? Who could help with a nutritional problem? Anybody?
You was my dietitian or?
Dietitian. Dietitian would be an example. If you had diabetes or if you had a heart problem or something like that, who would help with a heart problem? Cardiologist. Okay, good. And then what about, I'm gonna ask Jarrell, what about an emotional problem? Who would help you with that, Jarrell? A therapist, yes, therapist, yep. So if you came into us as chiropractors, we're not gonna see you for a nutritional problem or emotional problem. We're gonna refer you to the right specialist, right? Now, what about a physical problem? Well, there's two types of physical problems. There's organic physical problems and there's inorganic. Organic is like tumors, like cancer. Okay, that would be organic physical problems. Who would we see for that? We would see like an oncologist, right? Somebody that helps with tumors and things that might provide some kind of radiation treatment therapy for that. Okay. Then we have the inorganic issues: bone, nerve, tendons, ligaments. Okay, that's where we come into play. So if you come in and you have a physical problem that's inorganic, we're going to be able to take a look at you. Okay. Now, if you look at your form handout here, there's three types. By the way, before we go there, anybody have any family members that have experienced problems in these areas? Anybody have any family members that experience any kind of nutritional problems? I have. You have? Okay. Emotional problems? I've had, right? We've all probably has something to a certain degree, okay? What about physical problems that are, inorganic, joint problems? Family members, you mentioned Jarrell, you said, what did you say your grandmother is? She's dealing with neck, she's dealing with joints, okay? Red, I'm used to calling him pastor. Red, what did he say? You mentioned your mother, she's dealing with, you said?
Physical with the knees and the joints, yeah.
Dealing with the knees, and she's
Arthritis.
dealing with arthritis, okay, she's dealing with knees, she's dealing with arthritis. And then you can concur, right, Steph? You couldn't think of anybody, who's like your mother-in-law, can concur, right? But mine, who did you put down? You put down your grandmother? You put down your dad. What kind of problem is he dealing with? He's dealing with back pain, right? So these are all these physical problems, right?
Yeah, that's the way you want to do it. We started with not only knowing their name, but listing, that's like on the back of the paper, we want to put their spouse, mother, father. So that should be on the back. And then at the top, the different conditions. So they can just check what are the typical, and the space where they can write in if there's one not written, you just write the common gateway conditions. And then, so that's the first step of getting them to admit, is writing it down. Then you would have engaged them at the beginning like you did to get it out of them. So you go to the presentation, you go to the triangle of health, you eliminate one at a time, you come over to the physical. And now we're starting to go into the engagement and personalization. So now we want to be very clear with admit, we definitely want names and chief complaints tied together. And then we're going to just follow the grid. So remember, we're going through the admit stage, consequences, personalization. So that's where we're headed right now, to create the awareness and the need. And what's the number one primary thing that we're trying to do right now is we're trying to get them to admit that they have a circle of influence, a spouse, mother, father that has a gateway problem that's affecting them, that's causing pain and restrictions in their life. And what are we trying to create? Empathy. We're trying to create empathy by doing this, because remember, that's what creates referrals, is empathy. And when it's real hard to say no, when you get somebody to admit that a loved one's having these problems, it's causing pain and restrictions, and it's limiting them in all these different activities of daily living, and even maybe some things they've tried, how long they've had it, and some things they've tried that hasn't worked. In other words, get them to admit, to see there is a problem with that person. And then, so that's what establishes need. So that's where we're headed right now. And then from there, we go into the solution, get them to see where the solution, and then we make an affordable offer. That's exactly what should be, that's the education. That's the core component of the sales. So remember, there's the content versus the sales. I just described the sales. That's the most important part of this presentation, what I just covered. So let's see how and we're getting ready to go into it right now, or we should be getting ready to go into it at a pretty deep level now.
And they're usually caused by 3 different type of injuries, okay? The first one is genetics. What does genetics mean? It means you're born with it. Now, if you're born with it, can we do away with that? No, we can't do away with it. The best thing we can do is we can treat the pain, right, associated with it. We can help it, give you some relief. Now, there's also another category. There's called major trauma. Okay, major trauma is like a car accident, like a slip and fall, okay? Minor trauma is something that you can do. If you do it a few times, it won't really bother you. But if you do it for a long period of time, it can cause problems, right? Jarrell, you mentioned your grandmother, correct? Do you think your grandmother, and you might not know the answers to these, do you think that your grandmother experienced that pain was a result of major trauma or minor trauma?
That was very good. That is exactly what you do right there. You explained it, gave the analogy, then you came right in and now you're personalizing. You said it, you pointed it out. It was very specific. You said their name and you're asking to connect the dot. That was exactly how you do it for that particular segment of engagement.
Like a car accident, football, or
And you did the right thing by saying you may not know the answer. Remember, that allows you that. Remember, when you do that, it allows them it allows them to not know, but not quit on you. That's what that does.
Old age, and I know she falling, like, in her old age.
Okay.
Old age, deteriorating.
deteriorating a little bit. Okay.
Fall don't help either.
Fall don't help. Okay.
So you can see why it's more difficult. The more people you have, the less personal you can get, and that's why it's like 7. That's why they say you can. That's why 7 or less is what you can control with high efficiency. Why? Because you can be very personal individually with 7. Well, as soon as you start getting the bigger numbers, you start losing control. Because even if you go over here, by the time you come over to the left, the people on the right now, their mind's wandering and they're going somewhere else.
Okay. So maybe over time, like a minor trauma, something that you do on the, like if for example, if I'm sweeping or cooking and cleaning on, here and now, then, but let's say I'm doing it all the time, I'm overexerting myself, then over time, it could cause a problem. So it could be like a minor trauma, okay? Remind you mentioned your dad. Do you know, can you recall if it's related to his injury, his back is related to like a major trauma? Or you think it's related to like a minor trauma? Minor trauma, okay, okay, good. Greg, you mentioned your mom, you think is related to?
Oh, she turned the camera. She should have left it alone. The positioning was good. It just need to be zoomed in. Now the positioning's off center.
You think you recall major trauma,
Like,
like,
major, I mean, she's in a car accident, okay.
And because it's off center, it's out of focus. Because it's on autofocus. So it's not focusing on him anymore. See, this is why you do recordings, guys, not just for your personal evaluation, but from the technical standpoint also. So you just learned, once you set it up, zoom in, position everything, don't move out of that area, and don't move the damn camera.
Did my life fail time? So it was just things like.
Type work she did.
Yeah, type what she does, yeah.
so it could be like a combination.
Yeah, for online, we don't need to see them. That's like when you guys see my videos I've taken that are in live seminars, you don't even see the people. So you can just zoom right in. We don't need to see anybody. We just need to see you given the presentation. And I really don't want them in the picture. Like the guy with the hoodie on, it doesn't matter. The other guy on the right, see, we really need a release from him. We really need a release from him if you were going to publish this online. So that's the other reason I kept everybody out of the picture. So I did not need a release and I could use the video.
Number two, it could be like a major trauma, like a car accident, right? But then it also could be something minor that could add on to that, right? Okay. By the way, on a scale of 0 to 10, what did you all put when you put your grandmother on a scale of 0 to 10? What did you rate? What do you think her pain level was? And then again, this is something that you may not know. You're just guessing based on how you interact with her lifestyle.
That was very good. You reinforced again. Hey, you may not know this. That's it. You have to say that when you're going for referrals.
Yeah,
5 and 6, okay? 5 and 6, yeah, okay. Wow, yeah. Remind, what do you think for your dad, like a 5? Okay. Greg,
I'll bring it probably about between 2 and 3.
2 and a 3? Steph, you concur?
Yes.
You concur about a 2 and 3, okay, so we're kind of like some in between, right? Some up there, some in between, and some low, so we're kind of like all over, okay, with the problems. Now, with these on a pain scale, sometimes they can cause other symptoms. You mentioned, Jarrell, that your grandmother, she had neck pain, is that correct? Does she have any other symptoms like numbness, tingling, shooting out the arms?
Okay, so that was real good. You're doing this really good. So you're not just going with the gateway, but you're looking for the associated symptoms with that. So you're just driving it, you're driving the pain deeper. You're increasing the awareness of the problem. That's good.
You know,
We don't have things in our family, so we're going to pain before, but
hands,
And you're doing a really good job of not talking at them. You're engaging them. That's really good. This is how you do it. It's interactive. It's not you yapping at them.
okay. Mine, about your dad, back pain, does he have any pain with his legs or any numbness and tingling or weakness or anything like that? Okay, not that you know of, okay. Pastor Greg?
now I did know that she had like tingling sometime in the hand, but she actually went and got therapy for the hand. It's called.
Did she?
Yeah, I forgot she called it. They put needles in between the joints.
Oh,
See, as soon as you hear that, as soon as I hear that his loved one went for therapy, what does that tell me? It was bad enough for her to act on it and spend time or money. What does that tell me? It tells me we have a high probability patient. We definitely should be able to get that person as a patient. They not only have the problem, it was affecting them enough where they actually acted on it, spent time or money to go try to get it helped. See, that's what, as soon as he said that, that's what registered in my mind. I'm making sure I nail this one down.
oh, wow. You concur with that, Steph?
Yes.
Okay.
And apparently that's his wife, I guess, but that's excellent how you nailed him and then immediately you reversed over to her. So you're actually showing some really good talking characteristics. I'm surprised that I didn't think you would be this good giving a presentation, to be honest with you, but you're showing really good characteristics, not just content, but delivery, engagement and delivery.
So, what is it about these problems and these symptoms? What do they affect? Well, they affect our activities of daily living, okay? But the number one activity of daily living that's being affected by these problems is work, okay? Second one is sleep. Third one is, bathing or shower, okay? When you think about your grandma, Jarrell, do you think that it bothers her? Do you know if it bothers her with any of those? Well, I'm gonna skip work. Is she currently working or is she retired? So she does work?
Remember, Chris, you just want to change out the word. You're saying, does it bother her? You don't want to use the word bother. You want to use the words pain and restrictions, not bother. Pain and restrictions are the words you always use with ADLs
Okay.
because that's what they feel. They don't feel bother. They feel pain and restrictions.
Words, see, active memory, rather than when the younger kids, something like that. Anything we have to do here, wake up, time what she woke up in pain.
She wakes up and that's what bothers sleep. Okay, so not so much maybe work, playing with the kids maybe, but definitely with sleep, okay? But mine, with your dad, did you notice if this back pain is bothering him with any activity?
Okay, so that's real good. You're going person to person. And remember, what's the rule with ADLs? It's the rule of 3. the more ADLs I can get them to admit to, what happens to the awareness, interest, desire, all that stuff increases, and it increases in their consciousness level. You can tell how they're talking a lot more specific about their loved one's problems now than when you first started. They were kind of a lot more vague and nebulous. So the awareness, you're driving the awareness deeper and deeper. But with ADLs, remember, and you may be doing this, we'll see, but we want them to admit to 3. Remember, it's like baseball, 3 strikeouts and you're out. Don't quit with them just admitting to 1 ADL. You want 3. So I want to get through this. Then I'm going to go through the indoor activities. Then I'm going to go to the outdoor activities. And then I may even throw in hobbies. I want them to admit to 3, okay? Because this is huge that they admit to more than 1.
Work, sleep.
Oh, he's a truck driver.
He's a truck driver. Okay.
Yeah, I don't stay with him like that.
Okay.
Okay.
You know your granny. Okay. So
I
that's
don't know his back again.
the back hurts him. Okay. Okay. So it could be hurting while he's maybe driving because he drives a lot. Okay. Okay. So that could be affecting work. Pastor Greg, do you think for your mom, father, is she working or is she
She works, I think, she's a housekeeper at a hotel, but I know the previous house that she worked at, they had steps and everything, so her constantly going up and down the steps, kind of, got the best of it, I would say. So they call us, her knees to be sore and stuff like that, going down 3 flights of steps sometimes a day. She could be, I know how to get a hotel with it, so, yeah.
Yeah, okay. Steph, you concur?
Yeah.
Okay. By the way, how many of you all you can say this for yourself or for your family, how many of you all have ever had any kind of medicine for your pain? Taking any pain pills, Tylenol, ibuprofen, right? Yeah, okay. So Tylenol, ibuprofen, can help with the pain, right, temporarily. We'll talk a little bit about the only problem with it can have side effects all the time. We'll talk a little bit more about that. Yeah, so there's some of the things that we've done.
Yeah, you went off topic there just a little bit. And it looks like you caught yourself.
So now what I want to do,
We're still on ADL. See, that's what I was afraid you were going to do, is you were going to go through the ADLs once. That's why I brought that up earlier. So we should come right back around and go to inside the house activities, boom, and then check them off again with each one. Outside the house activities, check them off again with each one. And remember, as the last, you can go to positions, standing, stooping, bending, walking, positions, not just ADLs, but what positions do they have trouble with due to their pain? Positions, standing, walking, stooping, bending, pushing, pulling, lifting. Okay, so it looks like you're going to move on from one ADL.
is I want to move on to what we call, well, actually what I want to do is, anybody in here has an old injury, like problems with their neck, they were in a car accident, anybody specifically in here? Nobody in here, old injury?
I mean, I always would be my back.
Oops, wait a minute. Let me get that back on here. Well, I really screwed the pooch on that one.
Opposite side of the sheet here. It's like a slip and fall. Okay, Greg, you mentioned other symptoms. You mentioned drill that your grandmother said she had neck pain, is that correct?
He's a truck driver.
He's a truck driver. Any kind of medicine for your pain? Technique. Well, actually what I want to do is, anybody in here has an old injury, like problems with their neck, they were in a car accident, anybody specifically in here? Nobody in here, old injury?
I mean, I always would be my back. My back actually went out before.
Now, just a comment. I don't know what Chris is doing there, but just a comment that, remember, if this is an in-office new patient orientation, we wouldn't be involving we wouldn't be talking about them and their problems because they're already patients. They're there. Everything would be geared toward their spouse, mother, or father. If it's a new patient orientation, if this is a new patient presentation that some of these people in the audience are not, then they're the primary focus first. We want to engage them about them first because we're trying to get them as new patients. So I don't really know what, okay, this says new patient orientation is what it says. So this is a new patient orientation. So I don't know why he's talking about them right now. You don't have to talk in a new patient orientation. We don't want to, they're already patients. We don't have to take them through admit consequences and personalization. So
You know, so
you shouldn't be talking about them right now. You should just keep moving on and engaging what he's talking, the content of what he's talking to, and engaging it relative to their loved ones that they wrote down. That's what we should be doing.
You had a situation? Okay. So Pastor Mike, you come on up here real quick.
Now, if they're not a patient, like, I don't, and because we don't invite them in, when you're doing a new patient orientation, we don't necessarily have the spouses come in. But if somebody was there, then yeah, we would, of course, engage them and take them through admit consequences and personalization. And it looks like that might be the case here.
Okay, all right, so Pastor,
Okay, so that's real good that he's bringing up front. I would say anytime you do a presentation, there always should be one point in the presentation where you bring somebody out of the audience up front and do a simple tell. And I go, what's the number one reason you should always bring somebody out of the audience? It awakens the audience. It makes everybody sit up straight in their seat and pay attention. And you saw that's what happened. As soon as he pulled them up, all the audience started like laughing, and I mean, it kind of got loud. See, that's exactly what we're talking about. It to increase the awareness of the audience. Always bring somebody up, and it's all you do is a simple talk tell. You do a simple talk tell exam, like if they have neck pain. Well, we already know what if I have somebody with neck pain, I pull somebody out of the audience, and that's who I would pull out. I'd said pull out somebody with neck pain's a lot easier than back, but neck pain. What are we gonna do to show the potential problem? Well, we already know active range of motion and overpressure, especially in extension, they probably won't be able to do in the neck, and especially foraminal compression. Now, if he was doing the neck, I would have had him sit down. I'd have had a chair. I'd have pulled a chair right up front there, and I would have had him sit down. Now, if it's low back, then you have him stand. But remember, what are the most common positive findings? Because that's what I want to show the audience is extension and range of motion and overpressure and either foraminal compression or KEMPs. So looks like that's what he's doing right now.
has been treating with us, for like a month now, about a month, right? And so some of the things.
Okay, so he's a patient. Yeah, I don't know why you're involving them. If they're already patients, we don't need to resell them. So I don't, unless there's somebody in the audience that's not a patient. Now, if you're doing a talk outside, this works really well if they're not a patient. And what I do is I target them. I'm going to look for, when I pull somebody out of the audience, who am I going to look for? It won't be an accident. I'm going to try to find a woman, somebody over 40 that's been in an accident before. And that's what I'll ask. I'll say, who here has been in an accident before? And I'm going to look for why a woman versus a man, because she'll admit to her problems more than a man will. She won't minimize them like a man will. And she's more willing to act on them, generally speaking. So I'll ask who, and if they've already been in an accident before, they have a high probability of still having a problem. So that's what I'll do when I pull somebody out of the audience. to give an example and connect the dots of cause and effect, how this accident caused this problem, and I'll do a range of motion, overpressure, and foraminal compression, and I'll explain what that is and why it was positive. See, that's how easy that is. But I focused it on somebody with a higher probability. I would not want to pull a 21-year-old out of the audience unless, you know, they've said they've had an injury before to the neck.
That we're doing, you may not feel as if you might have felt like when we first started treatment, but we're just basically going through a series of the things that we would do to check to see whether or not this is a problem that we can help with. So the first thing we do is we're going to check like range of motion. Okay, so I'm gonna have you stand, turn, and facing this way. Okay, and then the first thing we'll do is we'll take the range of motion. Why are we taking the range of motion? Because that's going to show what joints are affected and what joints need to be treated. Okay, so
See, what's the main problems we talk about? Joint pressure, nerve pressure, disc pressure. See, the common things you're given diagnosis to every day. I go, this is, so when I find the problem, I go, now I'll also, if it's the neck, I'll also do Adson's test while they're sitting there. I'll try not to do the neck exam with them standing because you can't control them as much. Their whole body can now weave. But I'll not only do range of motion compression, but I'll do Adson's test. And if they have pressure, then obviously also they'll have joint pressure, I'll tell them. Or if they have, or possible disc, if I push down, or if I pull up and it's relieved. And if I have any tingling or numbness, then I'll explain how they could possibly have a pinched nerve, and I'll explain that. I mean, how easy is that? A real simple talk-tell exam, range of motion, overpressure, foraminal compression, or Kemp's. And if you're doing the neck, do Adson's. And then you got your 3 associated problems: joint pressure, disc pressure, nerve pressure. I can pull 10 people out of an audience and 7 of them will have that problem in their neck or their low back.
I would have him like bend down as far as he can. Then I would press to see if there's any discomfort with that. Good. Then I'll have him lean back as far as he can. Discomfort when I'm pressing. Lean to the side. Good. Any discomfort with that? Other side. Discomfort there. Now, why am I?
See, that's good how he positioned him. Chris was paying attention to the audience, that he's not standing between the patient and the audience. He's putting them sideways so they can see him and so they can see both of them cleanly. So he positioned them real well.
Having to do the movements and press, right? Because there's 3 types of motion. There's active. Everybody do this. This is active range of motion. Okay.
I would not be going into that. That's going down a rabbit hole right there. That's a little too much for lay people when you go into active, passive, and joint motion. That's a little too much.
Now,
I'm just going to go into overpressure, range of motion overpressure, but that's a little bit down the rabbit hole right there.
go as far as you can. Now, take your hand and see if you can press down a little further. Can you do it? Can you move down a little further? That's called overpressure. Overpressure motion, you can relax now. Overpressure motion is the type of motion that you won't necessarily achieve unless you're picking up something heavy. So you ever notice, maybe dad or grandma?
Yeah, I would leave this out of the presentation. Just take your 3 ranges of motion and take it out of the presentation. You're starting to, you can start to lose them right here. It's too detailed. There's not a good picture of it. I mean, it usually takes me several times to explain it to chiropractors, and I got to give them the visual aid of anatomical failure. So take this out of the presentation. Just stick with range of motion overpressure. Don't try to explain the difference.
Mom may say, well, I feel it when I pick up the laundry, or maybe when I pick up groceries, or Maybe when I go to pick up the grandchildren, I may feel something in me, right? Because it's the old, because typically active range of motion clears up really quick. But overpressure range of motion, and then the final motion is the joint motion, that typically takes a lot longer time, okay? I'm gonna have you, give yourself a hug. So what I'm gonna do is the orthopedic test, and this test is the ligaments, okay? I'm gonna have you twist, turn here, like that, and discomfort there, good. Twist and turn there, discomfort with that, good, okay. So, Pastor Greg here, he's been with us for over a month, he's already experienced some benefits, that's why he's not feeling anything. But these are some of the things that we would do.
And by the way, just so you know, I would never say how long the patient was with me. Why? You got a new audience. Now this is if it's potential patients. I'm never going to say, even though he's doing good, I would never say, yeah, I've been treating him for a month or 2 months. I would never. Now, if you treated them in 1 or 2 visits and they were already feeling better, yes. But when you said a month, what'd you just do to people in the audience with time? You just magnify. Do they think they want to spend a month with you in treatment? No way in hell. Don't do that. Don't say how long somebody's been with you. You're magnifying an obstacle of time. So only talk about, a few treatments or after a few treatments. Don't magnify time to people in your audience or who you're talking to that you're trying to get to come in. Don't do that.
Test the motions and the joints to see whether or not they're having a problem that we can help, a physical problem that we can help with. So let's give Pastor Greg a hand demonstration for that. So now we're gonna move on to what we call the.
I don't know why he called him. I mean, he brought him up and got everybody's attention and all that, but I don't know the point that he was trying to point out right now, unless he was trying to say, he's already doing better. Well, if that was the case, he wasn't real clear. He wasn't making that real clear distinction that, yeah, he had this problem before we started treatment. And so you would go into the chief complaint, the intensity and the frequency and some of the ADLs. And then you go, after treatment, this is where he's at now with intensity, frequency, and ADLs. And then maybe do some of those tests to show that they're getting better. That's the only reason, but it wasn't real clear. You didn't accentuate that at all. So I'm really not sure the purpose of why you brought them up. He's already a patient. So, and this is the new patient orientation. So I don't think there's anybody new here. So I don't know why you brought them up.
3 phases of healing. How many of y'all remember me talking about the 3 phases of healing? 1, 2, 3. Okay, so 3 of you all remember. So there's 3 phases of healing. Does anybody remember the first phase?
Okay, now I'm going to point this out because I've seen you do this a few times. You never ask people for something that you haven't taught them, unless you're trying to get their attention. Never ask, like, and they don't remember. This is too far back. Okay. So you tell them first, and then you can engage them later about it, but never not tell them and then ask them, unless you're doing it on purpose to make them think and get their attention. So the structure wise, I wouldn't have done that. You should have just went right into it. Let me go over the 3 phases of healing, and let's do a comparison contrast of how it's treated. You should have just moved right into it.
Inflammation phase, good job, Steph. And then anybody remember the 2nd phase of healing? Repair. So it's the repair phase. I'm gonna let somebody ask this other one, Steph, okay? So they won't feel left out.
And I'm not going to spend a lot of time here because that's not where I want to spend the time. I want to spend the time in comparison contrast, not to see if they remember the 3 phases of healing.
So we got inflammation, we got repair.
Unless I'm doing it purposely to get their attention, but that's not the case. They're all paying attention.
And then what's the last phase? You might know.
Remodel.
Remodeling, right? So inflammation, with the inflammation phase. So what we're gonna do is I'm gonna talk about each phase, and then I'm gonna talk about the difference or comparison between your general practitioner, the physical therapist, and the chiropractor. Okay? So in the first phase, in the inflammation phase, you're gonna have swelling, you're gonna have pain and tenderness. Now, how many of you all have imagined, either for yourselves or
Now, I will say this, the video says this is 35 minutes long. He's at 22:44, roughly at 23 minutes. So where's the majority of time being spent? Where do we want them from a time allocation standpoint? We want most of the time spent in them in admitting to the ADLs. So we should have moved quicker through the triangle of health. Spent more time in ADLs, and we should have went and gotten 3 and not 1. Remember, we want to spend more time where that time is more valuable. So there was too much time spent on the triangle of health. We should have spent more time in the ADLs and got to at least 3 admit ADLs. And now this basically takes time here, going through the 3 phases, the therapeutic protocol, and what's the goal of the therapy, and doing a comparison and contrast. Generally, this takes a little bit of time.
for your family members or friends that when they first got injured, they might have went to their primary doctor, the general practitioner. Anybody? Okay, just like I did when I was in my car accident. First place I went to was the hospital, and they gave me medication. Okay, what is typically your general practitioner or your medical doctor? What are they going to do when they see you? They're going to examine you. Okay, what else are they going to do?
That was the wrong question. You asked the wrong question. You should have went to treatment, not what are they going to do? What's the typical treatment for the medical doctor? So we're talking about it. You didn't present this clearly of what you were trying to do right now. I still don't know. If I'm in the audience, I still don't know what you're trying to accomplish right now. So you've got to do a better job of announcing of what you're trying to accomplish. In other words, what's the title of this section of the presentation? And this is what it would have sounded like. Let's take a few minutes now and let's go over and do a comparison and contrast of the 3 phases of healing. And let's take a look at how now 3 different providers, like a physical therapist, medical doctor, and chiropractor, let's take a look at how each of them treat each of the conditions separately and what it would mean to you in regards to healing. See, now I'm telling them what I'm getting ready to talk about. That needs to be way better emphasized than what you just did. You just kind of mumbled into it.
Anybody else know? After they examine you? I just said it for myself a little while ago. I escaped him.
And remember, we're not only giving the content, but when we give the content, we want to engage the individual with the loved one that we're going after as a new patient. Remember, we're not just giving content. We need to give the content and then personalize it. So we're going to give the explanation. That's, in other words, this is what we should see. We're going to give the explanation. So what was so the first thing we should have said is, well, what's the therapeutic protocol? So what's the goal in each one of these phases? So the goal of the inflammation phase, decrease pain, inflammation, etc. Okay. So now you go ahead and you start with each of the providers. You go to the medicine. Then when you finish, you go, okay, then check off that person or that person's loved one relative to what you're talking about. So let's see what happens.
They're gonna give you medication, right? Now, is anything wrong with that? No. No. Why? Because it helps with the inflammation phase. In the inflammation phase, you're gonna have swelling, you're gonna have tenderness. And taking NSAIDs like ibuprofen, aspirin, that's good for that inflammation phase. Okay? All right. what about the physical therapist? What are they gonna do in the information phase? Well, you typically not gonna see them in the information phase, right? They really don't deal with the information. They're not general practitioners. They're not chiropractic physicians like ourselves where we don't require a referral. They require a referral. So you won't see them in the information.
That's called a primary care provider. It's called a primary care provider.
Now, us chiropractors, what are we gonna do? We're gonna do what we call physiological therapeutics. What does that mean? We're gonna do therapy to help reduce the pain and reduce the inflammation, but it's gonna be without side effects. Does that make sense? How many of y'all have experienced when you first came in, we did the sticky pads on your back or your neck, right? That was a form of therapy to help reduce the pain and the inflammation called Easton, okay? Did you experience any side effects with that? No, right? So we do therapy in the inflammation phase without the side effects. The medicine helps short term, but long term, it can cause what? Side effects. Okay, so that's something to keep in mind. Somebody mentioned the second phase. Was that you, Steph?
Okay, he missed it. And I thought he was gonna miss it. That's why I talked about it earlier. I could tell how he was going. That should have been engaged. Right now, he's giving content with no sales. And that's terrible. Remember, if you only had an option of one versus the other, sales is what gets you the business, not education. The goal is to combine both of them. So he didn't include any personalization with that topic. He covered it, gave the information, and then he didn't engage the audience with their family member who he's trying to get as a patient. That's called sales. So he totally missed the sales part of the presentation right now. And he's moving on. He's going to the repair phase. Now it's a little scary because if he missed it here, what's the chances he's going to miss it in the repair phase and then miss it in the remodel phase and just give information? See, so this is not good. This is not heading in a good direction right now. So what should have happened? After we explained it, like he finished explained it, he should not be moving on right now. He should be engaging them, say, and each one of them, hey, did your mom, and obviously it's good to say the name and the chief complaint if you can remember. Okay. So is your mom, what did she do? Did she take any medication when she had her problem and neck pain, whatever? Okay. Engage them with the problem and the name of the person and the problem and relate it to what you're talking about. Did they take any medication? Were they given any medication? Do you know what that was? Okay. You got to personalize it. All right. Repair phase.
The repair phase, right? What happens in the repair phase? Well, our bodies begin, our problems of neck, our back, or joints, wherever we are in our body begins to heal through what we call scar tissue. And scar tissue, it'll heal, but without any therapy at all, it's going to heal wrong. It's going to heal with increased nerve sensitivity. That's why we feel pain, right? And it's going to heal trapping those nerves in our neck and back. So that when we go to bend over and pick up something heavy, they're going to tighten up on those nerves, right? And that's why we have pain when we do certain movements, okay? Now, with that, when you go to the primary.
Okay, so let's talk about that a little second. So what should have happened here is we should have listed, or it should be in the outline, or on the board, but it definitely should be in the outline, the 4 negative aspects that happen in the repair phase. So he should have put in there the increased number of nerves, or the nerves can get trapped. Those are 2 sources of pain. So number 1 and number 2, and then number 3 and number 4 is that scar tissue is only 70% as strong. You should have included that right now. That's what should have happened right now. Now, the thing that he's missing also, he's not saying what is the therapeutic goal of that phase. And now we know why, because we listed the reasons. We go, this is why. Remember, we're matching the therapeutic goal with physiology. You didn't tell them the physiology yet. You did, but it's not written down. It's not specific. But you want it written down, because remember, it's a lot easier to see than to hear. But you'd like them to see it and hear it.
If you go back to the primary in the second phase, by the way, the inflammation phase lasts about 3 days, 72 hours.
Don't go into time. Do remember, if this is a new patient presentation, do not give the time of the phases of healing, because you're magnifying the obstacle of time. Nobody wants to think that it's going to take 3 months or 4 or 5 months to feel better, or they're going to need that much treatment. Do not do that. That's a huge mistake. It's true clinically, but you cannot do that. Don't give, you can go through the phases, but don't give the time. If there's new people in the audience that you're trying to get.
The repair phase lasts from 6 to 12 weeks. The remodel phase lasts from 12 weeks up to a year. So if you
See, he's not even thinking about that. He's not even thinking that if somebody's in the audience that's new, they don't want to spend a year getting care. He's not even realizing that.
back to your general practice,
You got to kind of think differently when you're talking about sales versus clinical and how one will negatively affect the other. Well, this is one of those cases where you don't want to talk about time.
practitioner, your primary, you go back to them in the repair phase, what are
That's like on your website. You don't want time on there at all. You can talk about the 3 phases of healing fine, but damn well don't put the time in there. A new patient looking at your website and you're talking about 3 phases of healing and it's going to take a year. And now you think they're going to call? Hell no, they're not going to call.
you do?
What do patients want? What do we want? What do I want when I have pain? I want it over as fast as possible. I don't want you to tell me it's going to take 12 months. So all my language on my website is what? Decreasing the pain and discomfort as fast as possible. And even if I do talk about increasing strength and mobility, I'm not going to give time.
Anybody know?
Repair phase.
Yeah.
See, you did it again. Chris, you need to make a note of this. You did it again. You're asking them for information before you've told them. And there was no reason. Like, again, if you're trying to get somebody's awareness, you did that. But that's not what's going on. This is a presentation mistake. You're asking them for information. You know, I see this in concerts a lot. You know, a lot of times the singers want the audience to sing along, and they'll be singing, and they won't warm the audience up at all for the next chorus line. I'm like, you should have at least said the chorus line first, and then when it's repeated again, then flip it to the audience. But they don't do that. They go right from their regular phrasing to the chorus line, and they put the mic out to the audience, and there's very little participation because they didn't warm up the audience. He didn't let them know. And then by the second time, if he does it again, you'll see a lot more of the audience with the same chorus line. Now there's a lot more participation. Do not ask people for information that you have not told them. Don't do that. You got to tell them first. Now that's a presentation problem. So Chris needs to write this down and not make this mistake when he does his presentations.
Anybody know
Why? How do they feel right now? You can make them feel stupid. Now, if you did it in one resistance, no big deal. You go to the second resistance and ask somebody something they didn't know and you didn't tell them, now you're creating a defensive reaction and making them feel stupid. Don't do that.
general practice, you go back to them, what are they typically gonna do?
Need more medication.
They're gonna give you more medication. Right? They'll give you more medication. Now, is the medication gonna help with that scar tissue? Right, so it's the wrong therapy in the repair phase. It's the right therapy, right, taking short term in the inflammation phase, right? But it's the wrong therapy in the repair phase, right? Because it doesn't help with that scar tissue, okay? Now, what about the physical therapist? Well, the physical therapist, again, you're not really gonna see them in that initial repair phase either. They simply are gonna you're gonna have to get a referral from the general practitioner to go see the physical therapist. So you typically won't see them in the repair phase. Now, what are we gonna do in the repair phase? Okay, we're gonna use what we call something like a chiropractic adjustment. What is a chiropractic adjustment gonna do? It's gonna help that scar tissue, instead of healing, trapping those nerves, specifically bothering you when you go to do something like lift something heavy, picking up the children, doing the laundry. It's gonna help, instead of the healing trap, it's gonna heal with proper alignment, decreasing the amount of nerves being trapped and irritated in your neck and back, in those joints, okay? So that's how we're gonna help as chiropractors, okay? And remember, there's also 3 ranges of motion that we talked about. What was the first one? Active. The second one was what? Overpressure. And the third one is joint
That's way too much and you need to get rid of that. You need to get rid of that also.
motion. Okay, I'm gonna talk about just a little bit how we help with that. Okay. Now, the final, what happens in the
And there you go. He blew it. No personalization. Where's the patience? Where's the patience he's trying to get? He's not in, we've gone through 2 phases now, and where's the spouse, mother, or father in the conversation? Now that's obviously a huge mistake, because we're doing the new patient orientation to, number one, increase their awareness. It'll definitely help them stay for care when they even way more. But we're doing the new patient orientation to get new patients. We're doing to engage their spouse, mother, father. So we're 0 for 2 on that right now.
final phase, what we say, what phase was that? The final phase? What do we say?
And how would that have sounded? Again, I'm going back to each one individually. I'm going to try to say the person's name, the chief complaint, and then I'm going to ask them, what did their doctor do? Did they go to, what did you do? What did they do? Did they go to the doctor? Did they go to physical therapist or chiropractor? Which one they do? And then what did they get? Medication? Okay. Can you see how the medication now, it was good because he covered that well. See, now we're personalizing it all. Take that third party person through the information you just presented.
Say, that was the
That was
remodel phase. Let's write the line. The remodel phase, the final phase of how your body's gonna heal. What's gonna happen in that final phase? The scar tissue is going.
Okay, the other thing Chris needs to do, and Chris, you need to write this down. Write down when you introduce the phases, you need to tell them what the therapeutic goal is. Okay, what is the goal of this phase? What's the goal of this phase? What's the goal? And remember, you had the 4 negative aspects of healing that you can relate it to back, explaining why that's the goal. But you didn't do that. You didn't cover the 4. You did verbally, but you just talked about scar tissue. That's all. So that could just be cleaned up a little better with more clarity. That's all. But make sure you tell them what is the goal of each of these phases and why. Well, we're matching it to the physiology of healing. See, it's not just my opinion.
Gonna start to loosen up, and it's gonna start to get stronger. But without any therapy at all, it would only loosen up and would only get stronger to about 70%. Has anybody in here, whether yourself or family, you noticed that if they injured themselves, they started to feel a little better, but they start feeling stiff? After an injury, you feel a little stiffness. It doesn't feel quite the same as it did before the injury, whether you're tweaking an ankle, whether you're injuring your back, right? It doesn't heal this. If you don't get the proper therapy, it can heal stiff, right? So that's what can occur in that third phase if you don't get the proper treatment. What's the other thing that happens? It heals weak. And who in here has had an injury?
See, that's why I say the 4 negative things should have been written down on the paper or even on the bulletin board. It's the same 4 things that you do in patient education, because that's what you're matching to the therapy. This is why this is the goal of the therapy in the inflammation phase, is because the nerves are more sensitive and they can get trapped in the scar tissue and there's inflammation. This is why physical medicine is important in the repair phase, because it helps to align the scar tissue and decrease the likelihood of the nerves getting trapped in that scar tissue. See, there's a reference point there. Right now, we don't have a clear reference point of cause and effect with the therapy versus the healing. So that needs to be done a lot better. And it's very easily done. All you had to do is just write down those 4 things, but and then you have to say, what's the goal of the therapy? In other words, we don't want it to just be your opinion. We want it to be third-party trust why they need this therapy or that therapy.
They felt good down the line, and then they feel like they re-injured themselves. Or they had or get aggravated. Does anybody have that happen?
Now, that's not what he should have said. He's totally not even talking about the potential new patients. He's left them. That should have been gauged to the potential new patients. That question should not have been generic and open-ended like that. It should have been specific to each of their individual relatives that he's trying to get as new patients, called cells. So he's kind of lost his way here. He's giving content with no sales.
Aggravating, you're feeling good for a while, and then all of a sudden, I think Pastor Greg mentioned, said my back went out, right? Why does that happen? Because if we get no therapy during that final phase, that scar tissue won't heal strong, okay? So what is the general practitioner, the doctor, going to do in the 3rd phase of healing? If you go back to them, more medication, don't give you more medication, right? Don't give you more and more medication. But we know that's the wrong therapy to use, right? In that 3rd phase.
See, it would be easier to show it's the wrong therapy because I don't want it to be my opinion. It'd be easier when I say it's the wrong therapy if I would have introduced and had it written out the 4 negative aspects of what happens, 2 that are neurological and 2 that are connective tissue. See, now it's not my opinion. I'm connecting his wrong medication in the rehab phase because it's doing nothing for the scar tissue, for its strength or its elastic mobility. That's not my opinion anymore. You don't want your chiropractic opinion. You need to connect it to the physiology. You need to connect the therapy to the physiology.
What about the physical therapist? Well, the physical therapist is great for the remodeling phase because they're going to help that scar tissue. They're going to have that scar tissue to help it to get stronger. They are great with gross range of motion. If you get an arm amputated, God forbid, if you wake up from a coma, they're great with gross range of motion. The only problem is they only help with active, right? They don't help with overpressure and joint motion.
That's the only place I would have introduced the 3 ranges of motion right there, and it'd been very simplistic. They're good with active, not with actually the deep motion of moving further.
Chiropractor adjustment helps with all 3 motions. Okay?
I need to connect it to the physiology. Right now, it's just your opinion. You just gave an opinion. You need to connect it to the physiology. In other words, chiropractic adjustment helps increase that scar tissue strength, helps increase that scar tissue mobility. See, because we covered that. So it's no longer an opinion. You're showing them the cause and effect relationship.
With active overpressure and joint motion. So that's the difference between the physical therapist and what the chiropractor does. Okay? And then we also do, as Pastor Gray, you can agree, we also do an office physical therapy to help strengthen that scar tissue as well. Okay? So what happens, how can a person end up with a permanent injury for the rest?
He's not personalizing. I mean, this is unbelievable. He did such a fantastic job in the first half. And nowhere, he's going third party again. He's totally forgot about the patients he's going after. He's not engaging in them at all. This is like really weird.
Of their life. This is a primary example. You get injured, and this has happened, this has even happened to myself. You get injured.
He's getting caught up in just giving information. See, the typical chiropractor just getting caught up in giving free information. That's not where you're going to get new patients. This should have been, all three of these phases should have been personalized with every one of those relatives that he engaged earlier. This is like weird. He did such a great job engaging them through the admit, consequences, personalization, ADLs. I mean, he set the table beautifully. And then we don't hear him from at all. He hasn't said anything about the spouses starting this new information with the 3 phases of healing. This is weird.
You go to the medical doctor. They take x-rays. They see no broken bones. They say you're okay. Here's some medicine for the muscle spasm and for the pain.
Remember, this is the solution phase. Establishing need, admit, consequences, and personalization was up front. Now we're going into comparison, contrast, solution, showing how you're the only answer. But he's not personalizing it at all.
Then you go on with the rest of your life. Your body goes through the 3 phases and it heals wrong. And you deal with what we call a permanent injury on for the rest of your life. Maybe that's happened to you to a certain degree, or you notice now it's happening to your family members. Okay. That can
Hold on. First time he said anything about a family member, and that was generic.
lead to the joints breaking down, the joints becoming unstable because those ligaments healed wrong. And that can lead to the #1 disability in the United States.
So remember, you should know the flow chart from trauma to osteoarthritis. It's about 4 steps. Trauma, heals wrong, abnormal movement, abnormal wear and tear, degeneration, osteoarthritis. That's the flow chart. That's the stair stepping, taking people from point A to point B, from trauma to osteoarthritis. I'd get that down. That's pretty important.
Osteoarthritis. Why did that happen? Because they never got the proper therapy in each phase. So how do we prevent that? Now we know, right? By giving the proper therapy in each phase. Okay, make sense? You guys yourselves a hand, you've been wonderful tonight. All right, so what I want to do now is I just want to make an offer. Okay, this is for any of your family members you mentioned. Okay, friends that you feel that may benefit from this.
No, and that's not what should happen. This should not be generic. Anybody you may know. No. This should have been very specific for each one of those people that he got to admit, each one of those relatives that he got to admit they had a problem. Should have been very specific. This needs to be specific, not
Dr. Howard, I can help you.
not generic.
Okay, what I want to do is offer a package. So what we're offering is a consultation with the doctor. It includes an exam, it includes that range of motion testing, so we can find out which joint is causing pain, so we can find the therapy to help with that joint. We're also going to do muscle testing, so we can see what muscle is causing pain, what muscle is weak, so we can do the proper therapy for that muscle. We're going to test the nerves to see what nerve is causing.
Okay, so he's doing the offer right. He's doing feature and benefit. And remember, what's the most important part when he gives into the diagnostics? It's the benefit, not the feature. So he's explaining, we'll do this, but this is why we do it. There should just be a little bit more emphasis on the benefit. He's being real low key on the benefit.
Pain, so we can do the proper therapy to help with that nerve. And we're going to do orthopedic testing. to see which ligaments have been affected, so we can do the proper therapy there.
And I noticed his mind is staying on ligaments as he's going through this. Every anatomy he's always talked about is ligaments. Maybe he's stuck on personal injury, I don't know. But it's not just ligaments. It's the joints, it's the disc, the tendons, the ligaments, the muscles. But that's not what he said. He's kind of focused on only talking about ligaments. That shouldn't be the case.
Help with that ligament. Also gonna do 3 chiropractic treatments, right? To help with that pain, help increase that active overpressure and joint motion. And we're gonna do 3 muscle pain relief therapies to help with bring down that pain and that sensitivity. Now, this is all valued typically for $490, but for tonight, you decide that you wanna get a gift for a family member or a friend, this is gonna be for $47. So if you decide you wanted to get that for a family member or friend, this is gonna be for $47 tonight. After tonight, guess what happened? They go back up to the What you get it for tonight is this gonna be for $47, okay? And I think we're limited in what we given away so far, so we'll probably have like three spots available. If anybody want to take care of that, take advantage of that for their loved ones or for their family members, okay? There's also, you guys know, we have a no-wait policy in the office. What does that mean? When you come to the office, you won't wait more than 7-8 minutes before you see. We can see you in the morning, afternoon, because we're open 9 to 6. And typically, when you come in and out of office, it doesn't take more.
So he gave the feature office, diagnostic clinical, he did the cost juxtaposition. This should be part of the guarantee. So we have a 2-part guarantee. If there's not 100% satisfaction within 72 hours, is your money back. And number 2, we have a 7-minute wait policy. You guys know that you don't wait more than 7 minutes when you come in for care. That's where he's at right now.
20 or 30 minutes at a time, okay? And we offer a guarantee. If you buy the package for your family member, they come in after that first visit, for whatever reason they didn't like it, they'll get their money back.
You got to say 72 hours. They can't ask for their money back a year later.
Okay, so it's a guarantee test. Okay, all right. So you guys have been great again. Let's give yourselves a hand. Any questions? Any questions? All right. So we got some pizza over here. We got.
Okay, what was wrong with that?
Sheet here, and the topic that we're gonna cover.
All right. So what was wrong with that offer? The main thing that was wrong with the offer is he left it open and generic. Okay, remember, what he should have done is she should have now remember, he lost a huge opportunity by not engaging that loved one through each of those 3 phases of healing. How much more would that have done for the empathy of that person? A lot more, okay? Because remember, that's what it's all about. How much empathy can you create through this dialogue to where you want it to be where they can't say no. That's how you want it. Okay. So he missed a major part of creating empathy. Okay. All right. And then when he did pretty good with it, but what was the big mistake he made for the offer? He didn't ask for a yes or no. He did not go one-on-one and ask for a yes or a no. Remember, it's a lot easier to generalize, especially in an audience. It's much easier to it's called diffusive responsibility. Now it's easy to let them off the hook because you stayed general. So that's why we say during when you do like a meal presentation, we'll do this and then we'll say, well, I'll tell you what, while you're eating a meal, I'll come around and talk with you personally about your problem to see if you're interested in the offer. Because it's much better to talk with them one-on-one about the problem. But in this particular case, I would have you just need to ask them, you've got to ask them one-on-one. Mary, are you interested in? Okay. Now it's a little more difficult in a group setting Because so when you finish, like one of the things you could have said is, I'll talk with, there's some pizza over here, whatever. I'll come around and talk with you individually if you're interested in that, in the offer for your loved one. But you need to do that. You can't let it end like that. Was unbelievably weak. It was a great offer. It was a pretty good offer he made, but the close was pathetically weak by just leaving it up to chance. Hell no. You don't want to put that kind of effort in and then leave it up to chance. You want to nail the damn thing down after you did a pretty good job on this whole thing. Nail it down, damn it. So I would have, when you closed, I'd have said, if there was a reason for them to stay, or I would have made them stay, say, let me talk with you individually before you leave to see if you're interested in the offer. I'd have said that. Okay. But you have to ask them directly, yes or no. Yes or no. Okay. Now, when they say, now most of them are going to say yes. Okay. When they say no, if they say no, remember, anytime anybody says no, what's the first thing that you say? We don't just go, okay, goodbye. No, you're not just going to quit on life. I can appreciate you're going to go into acknowledgement. You're going to go into agreement. Why? To lower their defenses. I can appreciate that. Hey, Mary, if you don't mind me asking, and then you're going to ask for permission. Mary, I can appreciate that. Hey, if you don't mind me asking, what would be the reason you would not want to take advantage of the offer? And you say it in negative phraseology like that. What would be the reason you would not want to take advantage of the offer? It's exactly how it's said. I'd write it down. I'd write it down what I just said. That's what you say when somebody doesn't say, yeah, I want it. Why? Now, why are you doing that? You're looking for the obstacle, okay? Because remember, I told you, 80% of the time, the obstacle you'll be able to overcome. They might go, well, they're out of town this week. No problem, Mary. I'll go ahead and extend it for next week. Will that work for you? See? You just can't stop at the first time somebody says no. You can't stop. You'll lose in life. You'll lose in life in everything if you stop the first time somebody says no. In anything. Okay, so write that down, and that'll. But I tell you, you'll if you do the presentation right, obviously most of them will say yes, and then the very few that say no, 80% of the obstacles you'll be able to overcome to get them to yes. Okay. All right. So in summary, so that was the close. You want to get one-on-one. Okay. Now imagine if he would have engaged them all the way through. They got to admit, they kept engaging to loved ones. They're not doing this. They're not doing that. They're doing the wrong thing. They're doing the wrong thing. If he'd have done it all the way through, came through with the offer, and then he said, here's the offer. Are you interested in taking, and even if he did it in public right now, are you interested in taking advantage of the offer for your mom, Mary, Joe? Are you interested? See, you know how hard it's going to be for that person to say no right now? But don't do what he did at the end and leave it open. Don't do that. It's like catching a fish and then let him off the hook when you got the fish on land. That's what he just did. Well, they're just going to hobble back into the water. Grab the damn fish. So it's got to be one-on-one. Ask them. Let me ask you, are you interested? Yes or no? I'm not going to say yes or no, but are you interested in taking advantage of the new patient special? That's what it would sound like. Okay. If not, I can appreciate and understand that. If you don't mind me asking, what would be the reason you would not want to? And shut the hell up and listen. 8 out of 10 times, it's something you can overcome. Okay. So let's do a summary on that. First of all, Chris is on here, right? Chris, I got to tell you, that was excellent. That was the first time Chris did that. that blew me away how good he was, not just in the content, but the delivery. I'm like, damn, it's like he was given presentations before. That was his first in-office presentation, new patient orientation. So I'm like, wow. I mean, I was floored how, the engagement, the personalization, your comfort level. It was like, that was really good. I mean, it takes me several times when I'm training associate doctors to get to that point of comfort level and all that. Okay, so everything worked out. I pointed out all the big things. Everything was good. He took them through the admit phase, consequences. He went to the triangle of health. He spent a little too much time on the triangle of health. And then he's making a big mistake by asking him questions about material he hasn't told him yet. You need to write that down, Chris. You got to stop that. So that's number one. And let me just hit this real quick here. Okay, so that's number one. So that's not a big deal, but you showed the connection with the triangle of hell. We spent too much time on that, but then you gave third-party credibility. Good. Okay. Came over to major minor trauma. Good. And then we did get the audience's names and chief complaints in the beginning, and then we started working them in to major minor trauma, and he did a great job with that. He got the person's name, he got the admit phase, he got the chief complaint gateway, he goes into the major minor trauma, engages them with major minor trauma, does a good job with that. I mean, he was just nailing it. I mean, it was like perfect going through this thing. It was like textbook. And then the very first thing that started slipping is he only went to one ADL. I'm like, oops, what ADL? It's 3. You never stop at one ADL. That's why I say I kind of give the analogy to baseball. ADLs are like baseball. 3 strikes and they're out. That drives the awareness and the empathy higher by going to 3, not 1. Okay. And then add in positions, not just ADLs, positions. What are the common positions people have pain or restrictions with? Standing, bending, lifting, stooping, pulling, pushing. I just write those down. I mean, there's just some things you got to know. What are the common symptoms? Pain, muscle spasms that people come to chiropractors for? Pain, muscle spasms, decreased mobility. What's the common ADLs? The top 4 ADLs: work, sleep, bathing, showering, dressing. What's the secondary ADLs? Cooking, cleaning, laundry. What's the tertiary ADLs? House maintenance, landscaping, gardening, hobbies. You should just know these. This is like 80% of everything you do every day. This is where you're going to get new patients. This is the language of new patients. Okay? Include in that body positions. What are the body positions you should just know that people have pain and restrictions with? Standing, bending, stooping, lifting, pulling, pushing. You should just memorize those. That's part of the consequences. So remember, it's admit. The consequences are ADLs. Include the body positioning with the ADLs. Okay, and we got them to at least 3. Okay, now you've established need. Okay, you're good. Then we go into the solution, though, problem solution. And we're getting them to see where we're going big funnel to small funnel to get them to see we're essentially the solution to the problem. If it's major minor trauma and it's a neuromusculoskeletal problem, that's what that is. So Chris did pretty good there. Again, he was asking questions before he gave them information. You should have listed the 3 phases. You should have listed the 4 negative aspects of healing and then started your presentation. And it should have been much clearer. Let's do a comparison contrast of how the difference in how you're treated with medicine, physical therapy, and chiropractic. That should have been much cleaner, clear, and obvious. Then when you go to that individual phase, tell them the therapeutic protocol. Well, here's the goal of the therapy here, and this is why. Okay. Now you do the matching And he did good with that. Here's the medication. But what did he miss out of the whole thing? The most important, he totally forgot about the patient he was going after. He didn't engage them at all through all the 3 phases of healing. I mean, it was amazing. He did such a great job here. And then there was absolutely nothing in the solution mode. I'm like, what just happened? So when we went into the inflammation, he should have asked after he gave the information, he should have done the sales part, which was the engagement, and said, what did your whoever it was, their name and did they go to, and then connect them to what you just said. Did they go to the medical doctor? Did they get medication? Do you know what medication they got? Okay. Did they go to the physical therapy? No. Okay. Here's what and then here's what chiropractic. You get the idea. Now you go to the second phase. Tell them what's the goal of the therapy and why. Now they know because they see the physiology. You got the 2 negative aspects to the nerves. You got 2 to the connective tissue. You want to that's what you're connecting the therapy to, is that, not you. Remember, we don't have the credibility. That's why you need to push it off to the healing, not you. So you went through that fine. I wouldn't have gone into the rabbit hole with active, passive, and joint motion like you did. And then, but we missed again the opportunity after you explained the goal of the goal of the repair phase is to increase all your mobility. And that's where chiropractic physical medicine is excellent. And there's 3 ranges of motion. Chiropractic goes through active, passive, and joint motion. It's fantastic. It's written right up there. So it affects all of these. Okay, then we want to personalize it. So you told them, now let's personalize it. Okay, would your mom do in the repair phase of healing with the medical doctor? Medicine? Okay. See how number 1, it's not the right therapy, but now you're running into a second problem. It's not only the right therapy to increase the mobility of the tissue. That's where physical medicine is. But now you got a problem. Now we're starting to deal with the side effects of the medication. No problem if it's only for a short time. Now you start taking a long time. And now I'm gonna say a few of the side effects of medication. Aspirin, 20% of kidney failures from aspirin. NSAIDs, non-steroidal anti-inflammatories, causes liver problems also. So this is where I'm going to just talk about some of the negative effects of aspirin and non-steroidal anti-inflammatory. The negative effect with non-steroidal anti-inflammatory is it decreases the synthesis of the healing tissue, the scar tissue. That's the negative. That's what NSAIDs does. It decreases the healing or the synthesis of the scar tissue. Aspirin, 20% of kidney, not liver, kidney failure is from aspirin. Those are the 2 negative things that I always like to say relative to aspirin and NSAIDs. I would just write that down. If you don't know that, I'd just write it down. Okay. So now I'll say that in the repair phase relative to aspirin and NSAIDs. You explained chiropractic, but what was the biggest thing we missed? We didn't personalize it. We did not engage them. Did they get any physical medicine for their problem here to affect the scar tissue healing? Missed it. And by the way, that category is the single biggest category in the population base of the need for chiropractic. The chiropractic is not needed in the inflammatory phase. There's other providers. It's not needed. Chiropractic is not needed in the rehabilitation phase. There's physical therapists. There's one place in the healing process that it's absolutely needed. It's in the repair phase of healing. Nobody does what chiropractic does in the repair phase of healing. Nobody. We're the only one that gives physical medicine in all 3 ranges of motion when it's needed the most, when the body's actually healing the connective tissue. Okay? So no engagement. I'm like, oh man. Then he did the same for the remodel phase. He did the comparison contrast pretty good. But there's no personalization. And then he even went generic, if you know of anybody. I'm like, what the hell if you know of anybody? We want the person right in front of you that you were just talking about 10 minutes ago. Not, do you know anybody? We want to talk about Mary. Keep driving it home. Okay, so that didn't happen. Goes through the offer, which is fine. He did okay with the offer. With diagnostics, therapeutics, features, benefits. I'd put a lot more emphasis on benefits with my tone and everything else. That's a minor though. So, and then he went through the juxtaposition offer, took it off the table, letting you know this price changes tomorrow and it's limited to these three. That was good. That was a act now or never. So that was good. And then he included the guarantee. Just make sure with the guarantee that you get 100% refund within 72 hours. Just make sure you say that there's a time limit on that. Okay. And then he made the second biggest, there was only really two mistakes he made. Everything was really good. The two mistakes he made was not engaging the person he had already had to finish it out into 3 phases of healing. That was a big mistake. And the biggest mistake, he didn't go for a yes or no personal one-on-one. That was the absolute biggest mistake he just did. He did all that work and a pretty good job. And then he let him off the hook. He got the fish on land and he didn't reach down and grab it. That's literally what just happened. Now, chances are he probably would have got some people to sign up, but you don't want to leave it to chances. You don't want to put that kind of time and energy in, bring the fish to the shore, and then go, well, I wonder if he's going to stay on shore or go back to the water. You don't want to chance it. You want to reel it in, bring it in, damn it. So once you had him there, now we had to get to the personalization. We want a yes or no from that person one-on-one. That was the biggest mistake he made. So we should have individually got with him, made him stay, like, before you leave, let me make sure I talk to you before you leave. And then he should have went right over to number one. Now, here's what you do when you go one-on-one. You do a real quick checklist. Get the name, the chief complaint, and real quick go through how it happened, the primary ADLs. We're just increasing their awareness again. Everything you've already done, but you're just going to take them through it real quick. So Mary had the problem. You said she had neck pain. You said it started. What was the reason you said she had the trauma? Was it major trauma? Okay, she had that. And what were the activities of daily living she had trouble with? This, and that. Okay. And was standing, stooping, bending, twisting? She had trouble in any of those? Okay, then. Now, having said that, are you interested in taking advantage of the new patient special for your mother? That's what it would have sounded like. Real quick, remind them before you ask them, when you go one-on-one, get a quick reminder of the pain. Admit consequences, personalization. That's what same if you're in a restaurant, you would say everything. Then you go, okay, you can go and eat now. I'll come around and talk to you one-on-one individually about your individual problem. Then you go, and that's all you do when they come back. You just go to them one-on-one, go through the admit consequences, personalization, ask them if they're interested in the offer. But you can't do what you did. You cannot just say, if you're interested, let me know. You can't do that. Okay. I just want to make sure that's driven home unbelievably. You did such a good job to be weak at such a moment in time. So anyway, overall, for a first presentation, like I said, and by the way, for the users that don't know it, Chris is getting 80% of the potential patients, the new patients, to come in. He only gave, I think, 2. That was a new patient orientation. He's given 2 new patient orientations or sales presentations. He's signing up 80% of his people. Well, you can see why, but you can see he could clean this up really easy. He can really take this over the top. Unbelievably easy. If he'd have just engaged that person into 3 phases healing and then personalize the offer, that'd have been off the charts. Off the charts. I was like, that's it. You got it. Okay. Very good. So that's how I'd evaluate that. So let me ask Chris a couple questions. Can you hear me, Chris?
Yeah, Doc, I can hear you.
Just a couple questions. One is, why did you forget to engage the new patient in the 3 phases of healing?
Well, I ran into a little bit of confusion with the new patient orientation material, the videos, and I think you can see that right after I kind of went through the ADLs, kind of how it kind of all unfolded. I was really kind of confused about the differences, which I'm glad you went through it because I would have not known how to clean that up. But I was just a little
Well,
confused.
wait a minute. Are you aware that you did not even engage him in the 3 phases of healing?
Yeah, so typically I'm used to doing the cell presentations where I'm engaging the audience based on what their findings are. But when it came to engaging the audience on their circle of influence, that's why I ran into the confusion. How do I ask about how do I continue to ask them about their circle of influences during the 3 phases? That's what I got confused
It's
about. And now you
exact,
can
yeah,
see
but
that there.
there's no reason to, because it's exactly the same, except you're doing third party. So instead of asking that person individually, like if it was you're going after them in a sales presentation, you do the exact same thing, but ask them third party. How about Mary? Is Mary blah, blah, blah? Did Mary go to the medical doctor? It's just exactly the same. It's just third party. That's it.
Yeah, well, I see that now. It's so easy to
Now,
say it
let
now,
me
but
ask
in
you
the
this.
moment.
During the presentation, were you aware you were not engaging them in the 3 phases?
I actually I was improvising to tell you the truth because I kind of like I said with the sales presentation, I engaged them. They're right in front of me. I ask that person and that person, what did you get in the inflammation phase? What did you do in but when it came to asking them, I just ran a confusion with how to ask them about their
It's the same
circle of
thing. What did
influence.
Mary do in the
Yeah, I just got confused. Yeah, I just got confused about that, and you can see that there. But the good news is that's an easy cleanup for me. So I'm glad we went over
I'm
this.
just curious about your mindset. Were you aware you were not engaging the potential patients when you were going through the 3 phases?
Doc, so many things, to be honest, so many things going through my mind. I was thinking about not going over the time. I was thinking about,
Okay, so
so many different
you
things.
weren't even aware of it then.
No, I was in a state of what you call it,
Okay,
when
okay, I
you know what
got
I
you.
mean?
I got you.
That's where
Yeah,
I was.
by the way, that you just spent a little too much time in the triangle of health,
Yeah.
and you should have just nailed a little more time in the ADLs, nailing 3 instead of 1, and then just
Okay.
gauging with the 3 phases as far as time wise. And that would have taken
Yeah.
that down to 30 minutes or 25 minutes. But even 35, that was not bad at all. 35 minutes, that was not bad at all. But let me get to the Chris, the main part was not asking them one-on-one if do you understand you can't do that?
Oh yeah, totally. And as soon as I did it, and right after I was like, oh my gosh, I should have did that because that's exactly what I do during the sales presentation dinners. So again, I was kind of confused about what were the subtle differences in the new patient orientation versus the sales presentation. And you saw that, you saw a reflection of that, how it began to unravel, towards the end there. So but again, I think that's going to be an easy cleanup, super easy.
Like when you do the sales presentation, do you ask them to commit in a group setting right then? Or do you say, I'll go ahead and have dinner and I'll talk with you one-on-one while you're having dinner?
The latter, yep. And
Okay.
that's why I was like, oh my gosh, should I have, immediately after I just let them go. I was like, oh my
Yeah.
gosh, I think I messed
Okay.
that up. You know what I mean? So,
So you knew immediately that was a screw up.
oh yeah, I knew that immediately.
Okay.
Yep,
That's
yeah.
good. Yeah, in that case, with the new patient, to be honest with you, in that case, the new patient orientation, I would have asked them from the stage one-on-one. You know why? You already know them.
Right.
They've already been in your office 5, 6, 7, 8 times. And it's a much smaller group. I would have just asked them one-on-one, say, are you interested in taking advantage of the new patient special? That's what I would have done. Now, if you're not going to do it, if you're not going to do it in the group setting like that, then you better make damn sure you hold them. Say, I tell you what, before you leave, like if they had food, I'd say, go ahead and have some food, but make sure I talk with you before you leave. But in the new patient orientation, I always just asked them, to be honest reason, the other reason I did, because it was a gimme. By the time I finished, it was a gimme. There was like no reason for you not to buy it. After everything I just took them through and engaged them with and they admitted to, it was a gimme. So I always just did it from the stage. Number one, I was already comfortable with them because they were already patients. It was a gimme. I engaged them all the way through with everything. And it was a small crowd. So when I finished, I just asked, are you interested? And that was like a no-brainer. It's like, oh yeah, sure. How about you, Mary? Oh yeah. How about you? Okay. All right. Let me just make sure we take care of that before you leave. Okay. There you go. But when it's a small group like that, I'd have just did it from the stage. But it is better if you can do one-on-one. That it is better because now you can quickly go through the checkpoints to remind them the pain points. But also if they say no, because in a group setting, they won't tell you the reason. It's much harder. If you don't mind me asking, what's the reason why? It's much harder for them to admit because it's in a group setting. They don't want to admit as much as if it was one-on-one. So that's why I said one-on-one's always best to close them. That's always best. But that's why in the group setting, I didn't do one-on-one in the dinners I did. But in the new patient orientation, I did not do one-on-one. I just asked them because to me it was a no-brainer. Because I engaged them the whole time through with everything. So it would have been like unheard of for them to go no. And if they did say no, it was like a really simple reason why, like they weren't going to be in town this week or, something, or they don't live here or something like that. But I got to tell you, that was really good. How you delivered your knowledge, you came across your engagement. Those were the only two things, that just, you clean those two things up. You're just a walking, talking new patient machine. I'm telling you. And you already know that. And you're already getting 80% of the people to sign up. And you're not even a black belt at it. You're pretty good at it, but and that's why I say, once you know how to give that new patient presentation and then one-on-one, because remember that, well, I'm not going to go too far in, but remember, when you know how to do that to your patients, now you get some high quality new patients from your patients. And then you know how to go and do it outside. And that can be a total combination of your 80%ers, a percentage of your 80 and 20%ers, plus cold calls, all cold calls, whatever. It could be a whole combination. But once you know how to do that in your office, out of your office, and then you know how to prepay patients, it is game over. You're going to now create way more patients than you physically can handle. And then they just get plugged into all the systems. Now, remember, when they come in, they go through all the same systems. When they come in, it's going to be spouse. If we haven't gotten their spouse, it's day 5 spouse. It's going to be the monthly in-office promotion. It's going to be the re-report referral. It's going to be the new patient orientation. I'm just going to keep following the tree limbs. It's like a tree. I'm just going to keep following those branches. And then I get new branches and then new branches. Then I'm going to go to those branches. And you just keep building and building. But once you know how to, that's why I say that presentation, I cannot give that presentation without somebody in the audience that has a problem not wanting to be a patient. That's a new patient machine presentation is what that is. You combine that with your patient retention, it's game over. Now you're dealing with little shit in chiropractic. And the whole world of business opportunities open from maximizing your financial, your potential, your income, associate doctors, satellite offices, selling offices. Your income exponentially goes up once you're a new patient machine. You know how to get and keep new patients. Then you want to start leveraging that knowledge. So anyway, that was real good. On a scale of 1 to 10, I'd easily say, man, that was an 8. You know, with that, you know, the big obviously goof up was not asking one-on-one. That was like huge. But outside of that, I'd say that was a 7, 8, you know, just engage them in the 3 phases and make sure you personalize it. And I'm telling you, Chris, you are off. And of course, you already know that. You're off to the races. All you need to do is get in front of people to do it, whether it's, and obviously you want to get in front of your patients, family members, and friends. That's where the gold's at. But I was impressed. I did not expect to see that for the first time.